Good morning. I'm Deputy Republican Leader Norine Hammond of the 94th District in Western Illinois. I serve as the Chief Budgeteer for the House Republican Caucus. We're here today to discuss a recent report from the Department of Healthcare and Family Services dated March 31st, of 2023, regarding the update enrollment and cost estimates related to health care benefits for undocumented immigrants. The HFS report shows a dramatic growth in undocumented immigrant participation, which will require nearly $1 billion in general revenue funds to support this program in fiscal year 2024. In each of the past 3 years, the Democratic majority has added more and more undocumented immigrant seniors and adults into the Medicaid-like healthcare coverage. The report recently released by HFS shows the initial cost overruns in FY21 related to the first expansion for seniors, specifically stating that, and I quote, in 2020, the Healthcare Benefits for Immigrant Seniors Program, HBIS, exceeded its appropriation in the first month of implementation. The initial cost overrun should have raised alarms with HFS, and the Pritzker administration should have shared this information with all of the members of the General Assembly. The HFS report shows that HFS and its contractual actuarial firm, Milliman, repeatedly underestimated actual enrollees and the costs. FY24 estimates now show growth in health care benefit coverage for eligible undocumented immigrants totaling 108,400 individuals over the original FY23 estimates, and enrollees totaling 31,500 individuals over the original FY23 estimates, a 202,000 and 94% increase, respectively. Much higher participation of undocumented immigrants in the health benefits expansion is only part of the miscalculation leading to increased costs within the program. The HFS report states, and again I quote, actual claims experience reflects higher enrollee costs than the traditional Medicaid population due to more untreated chronic conditions and higher hospital costs. The report indicates that Milliman believes the estimate for expanded health benefits for undocumented immigrant adults will total nearly $222 million in FY23 and nearly $990 million in FY24, which represents a $768 million increase, equaling 346% year over year. Undocumented immigrants are ineligible for any federal match. I'll repeat that. Undocumented immigrants are ineligible for any federal Medicaid match, resulting in the state GRF being used to pay for the entirety of services provided. The additional Medicaid pressure for these expansions is happening at the same time that the state is expected to lose $760 million in additional federal funding through the Enhanced Federal Medical Assistance Program, or FMAP, that was provided to the states during the pandemic. Several important state programs are still drastically underfunded and could greatly benefit from the $990 million in GRF that would go to HFS to continue to provide medical services to undocumented immigrants. The $990 million could be used to manage the systemic challenges within the Department of Children and Family Services that have contributed to rising costs, cases of child abuse, and deaths. The $990 million could be used to support services to the developmentally disabled, as outlined by the Guidehouse rate study commissioned by the Department of Human Services. The $990 million could be used to address the substantial workforce shortages within our nursing homes across the state. It could be used to increase funding available for the statewide database known as the Prioritization for Urgency of Need for Services, or the PUNS list, in an effort to increase the number of people served and the quality of resources available. You get my point. Unless drastic action is taken, the state of Illinois will spend nearly $1 billion of taxpayer funds on health care benefits for undocumented immigrants, adults in FY24. These ballooning enrollments and costs are simply unsustainable and will lead to the loss of funding for services for our most vulnerable citizens.